Osteoporosis can be a tough condition to manage, especially if you're at high risk of fractures. Luckily, there are treatments available that can help strengthen your bones and reduce the risk of breaking them. One such treatment is Evenity, a relatively new option that's been gaining attention. In this video, we're diving into the top 10 facts about Evenity so you can get a clear picture of what it's all about and whether it might be the right choice for you. Whether you're newly diagnosed or exploring new treatment options, understanding Evenity's benefits and potential drawbacks can help you make an informed decision. Number 1. What is Evenity? Evenity is a medication specifically designed to treat osteoporosis in postmenopausal women who are at high risk for fractures. Its active ingredient is ribosozumab AQQG, a type of drug known as a monoclonal antibody. This means it's crafted to target specific proteins in your body. In this case, a protein called sclerostin that affects bone health. Administered as a subcutaneous injection, Evenity is given once a month. It might sound technical, but essentially, this drug is engineered to help your bones stay strong by influencing how they're built and maintained. If you're familiar with other osteoporosis treatments, Evenity might feel like a fresh approach to managing your bone health. Number 2. Why is Evenity FDA approved? The FDA has approved Evenity for treating osteoporosis in postmenopausal women who have a high risk of fractures. This approval means that the drug has met the FDA's rigorous standards for safety and efficacy. However, Evenity can also be prescribed off-label for other conditions, which is when a medication approved for one use is used for another, not officially approved use. Understanding why Evenity received FDA approval can help reassure you about its effectiveness. It's been tested extensively and shown to meet the standards necessary to help manage osteoporosis, especially in those who've struggled with other treatments. Number 3. How does Evenity work? Evenity works by targeting a protein called sclerostin, which plays a role in regulating bone formation and breakdown. By blocking sclerostin, Evenity helps stimulate the cells that build new bone and slows down the breakdown of old bone. This dual action is crucial for improving bone density and strength. The goal of Evenity is to help your body rebuild bone more effectively and maintain stronger bones over time. If you've had trouble with other medications or treatments, Evenity's unique mechanisms might offer a new way to manage your osteoporosis. Number 4. Is Evenity effective? Yes, Evenity is shown to be quite effective in clinical trials. Research indicates that people using Evenity have experienced fewer spinal fractures compared to those receiving a placebo. In some studies, Evenity users even had better outcomes than those taking other common osteoporosis drugs, such as alendronate. Effectiveness is key when it comes to osteoporosis treatments, and Evenity's results suggest it can be a strong contender. If you're evaluating your options, these positive outcomes might make Evenity worth considering. Number 5. How is Evenity administered? Evenity is administered through a subcutaneous injection, which means the medication is injected just under the skin. Each month, you'll receive 2 injections, one immediately after the other. These injections can be given in your abdomen, thigh, or upper arm, but they should be spaced apart from each other. The process is usually done at your doctor's office or clinic. While the idea of injections might not be the most appealing, they are a straightforward way to ensure you receive your medication consistently and effectively. We made a book, 10 questions everyone should ask their pharmacist. You can find a link in the description below. Feel free to check it out. Number 6. What are the side effects and risks of Evenity? Like all medications, Evenity comes with potential side effects. Common issues might include injection site reactions or flu-like symptoms. More serious risks include a boxed warning from the FDA about potential heart attack and stroke, which is why it's not recommended for those who have recently had these events. Your doctor will monitor you closely for any side effects and can help manage them if they occur. It's important to stay informed and communicate with your healthcare provider to address any concerns about potential risks. Number 7. How does Evenity interact with lifestyle factors? Even though Evenity doesn't interact directly with alcohol, drinking large amounts regularly can worsen osteoporosis and impact bone health. It's also important to ensure you're getting enough calcium and vitamin D, as Evenity can sometimes lower calcium levels in your blood. Balancing lifestyle factors with your treatment is crucial. If you enjoy a glass of wine now and then, that's typically fine, but be sure to discuss your alcohol consumption with your doctor to avoid any negative impacts on your treatment plan. Number 8. What about the costs and insurance for Evenity? Evenity can be pricey, and the cost might be a concern. Insurance coverage varies, so it's a good idea to check with your provider about what's covered and what you might need to pay out of pocket. There are also financial assistance programs that can help with the cost. Understanding the financial aspects can help you plan better and reduce any surprises. Your healthcare provider's office might also have resources to help you navigate the costs and insurance requirements. Number 9. What are the alternatives to Evenity? Evenity isn't the only option for treating osteoporosis. Other treatments include bisphosphonates like alendronate and medications like Forteo. Each treatment works differently, so it's useful to compare these options based on your specific needs and health conditions. Exploring alternatives helps ensure you choose the best treatment for your situation. Your doctor can provide insights into how Evenity stacks up against other treatments and help you make an informed choice. Number 10. Who should consider Evenity? Evenity is specifically approved for postmenopausal women at high risk for fractures. It's not recommended for use in children, during pregnancy, or while breastfeeding. If you have certain medical conditions, such as severe kidney problems or dental issues, it's important to discuss these with your doctor before starting Evenity. Determining if Evenity is right for you involves considering your overall health and treatment goals. Your healthcare provider can help you weigh the benefits and risks based on your individual health profile. Hey, I'm Dr. V and welcome to my channel. Please check more of my videos about health and medication. And cheers to a healthy life.